Hello, my name is Chantel Lacey, and I'm the student nurse here at the inpatient hospital, working with my patient who has been here for 2 weeks, Mr. Brian, a 43-year-old male who came in with a bowel obstruction and ended up having to get an colostomy appliance applied in a stoma, you know, performed in the colon area so that he can be able to defecate bowels. Since that stay, we have progressed to having him on 2 liters of nasal cannula, which occurred last week. And currently now he has developed a productive cough in which the doctor has ordered him antitussive cough medicine to help control. He is asymptomatic with that cough. And we're trying to get him better. So he has requested my services to give him his cough medicine that was ordered PRN. I'm sorry, that was ordered, not PRN. Well, it was ordered PRN or as by mouth. He can get it every 8 hours PRN. So he's asking for that. So I'm getting ready to head into the med fixes where I'm going to check for that order, which is my first check that I'm going to do. I'm going to perform hand hygiene, go into the med fixes for his order. I'm going to compare the order. Prepare the order for the patient. So I put the order. We have Tylenol. I'm sorry, we have an antitussive oral cough syrup, but I want to use Tylenol as the example because it's the only thing I have that's liquid in my house. And I'm going to pour this med. It's in a multi-dose bottle that can, just for the patient, so it can be used more than one time. And it comes with the 10 ml cup, med cup. I'm gonna check on the medication. I'm gonna be checking for the expiration dates. I am going to compare the medication label with the MAR to make sure I got the right medication that came up from the pharmacy. I'm gonna calculate any doses that may need to be calculated. If so, but this is a pretty simple one. He's only getting 10 mLs of this cough medicine, this antitussive. Once that's done, that is my second check. So while I'm in the Pyxis and I perform hand hygiene, I'm going to pour this medication into the measuring cup. I'm going to have to now bend my laptop down so you guys can see that because this has to be done at eye level. And to make sure that there is an accurate measurement amount. So I'm going to let you see me do that. So I'm going to always hold the label into my palm. Sometimes you can shake it to mix it up a little bit because I'm sure it settles. So I'm going to hold it into my palm. I'm going to open it. And we're going to perform this at eye level, which means I do have to get down a little. So hopefully you can see me. We're going to do 10 mLs. And that's just at the meniscus line. And you hold it up so that it doesn't drip, and then you will take and you will wipe the top of the bottle or the rim of the bottle off with a tissue. you secure this back, and then this will get replaced back into the Medipixes. I'll replace the liquid back into the multi-dose, to place the multi-dose bottle back into the medication supply system and lock the medication pixes before leaving out of the med room. And that's done. I'm going to now take all my medications, which you do get medications for one patient at a time. You do not put extra other patients' medications with the medications that you're carrying because it can get confusing. So I'm going to take Brian's medication to his bedside. And at the and if it was a scheduled dose, I will make sure I gave this dose on time instead of giving it PRN. But if it was a scheduled dose that he's getting, I will make sure I get that scheduled dose to him on time. That way it keeps any of his symptoms from occurring too quickly, coming back too fast, and having him to ask for it. I can offer it beforehand to make sure that he does want that one time. But since this is a PRN dose and he requested it, we're just going to go from there. I get to the patient's room. I perform hand hygiene. I identify my patient, Brian, using 2 identifiers. He has a armband on that has his name and birthday, as well as his bar scan number. So I'm going to compare that with the MAR to make sure I got the right patient. And then I'm going to ask him what his name is and what his date of birth. And he's going to state that for me. Once he states that for me, I then will assess my patient for any allergies that he may have, knowingly or unknowingly. I will assess his breathing if I have to, because this is going to be a I think it's like, well, it keeps it from like an antihypertensive, no, not hypertension, I'm sorry. It's like a depressant because it's going to depress his cough. It's a histamine blocker. So I'm going to then, once I assess his allergies, assess his cough, I'm going to assist him into a upright position. I'm going to explain to him what I am, what my action is and what the purpose is of this medication that I'm giving to him. Then that he asks for it, he's aware that it is to suppress his cough that he's having. I'm going to scan his barcode on his armband, which consists of my 3rd check also, to make sure that it matches up with the right dose amount, right patient, right medication, right route. And then I'm going to ask him if he would like to take this medication himself, or does he need my help? Just hand him the cup and he can drink it. I'm going to stay there until the patient completely finishes the medication. I do not leave it at the bedside. Once he's done, I will assist removing the cup, and I will, replace it in the proper trash receptacle that I need to. Once that's done, I will, once he takes it, the reason why he gets set in the upright position is because it's to avoid any aspirations. Even though he may not have any swallowing problems or difficulties, we don't want nothing to occur, to become brand new that happens while he's staying with us in the hospital. As far as him, now have this cough, we don't need anything extra added on. So I'm assisting him in that upright position. He's done taking this medicine. And then I'm going to reposition him, help him get back into a comfortable position. I'm going to complete my my assessment of him. I'm going to document the action that was taken, how the patient reacted to the therapeutic action of receiving his medicine. And then I'm going to come back and then reevaluate him once this medication has took effect to see how his cough is doing. And I'm gonna let him know, give him his call light. If you have any questions, you know, ring out for me. If he needs something to drink to get the taste out of his mouth, I will offer that to him too before I leave the room. So Brian took the medication very well without any problems. I came back to evaluate him about 10-15 minutes later, and he said that the cough was better, that it wasn't as productive, that it has slowed down. And I document that evaluation of the patient, of the therapy. With that being said, I now have done my job as his nurse for tonight in giving him his oral medication. Hopefully he does not occur with any other problems with his stay here in the hospital, and he can go home very soon. So hopefully, with that being said, I will see you guys next week with an update on my patient Brian, who has been with me for 3 weeks. Talk to you later. Have a good day.